All right, so now that we're all slightly postprandial, we'll shift gears a little bit, as Mark said, to less strictly medically oriented, but something that I think is really exciting that we're starting to explore at Children's, and we thought we'd talk about a little bit today. So our objectives for the next few minutes are to think about how you're currently partnering with parents in your practice, identify some additional ways that you may partner with parents, and then I'll tell you just a little bit about the Parent Navigator program that we have started at Children's. So, let's think through quickly. Does your practice provide care for children and youth with special health care needs, coordinate care with specialists, collaborate with families to develop care plans for children and youth with special health care needs, link families with community resources, and feel comfortable and confident providing care for children and youth with special health care needs? My guess is that you're sitting there looking at that list and thinking, yeah, we do most or all of those things, right? And that's a lot of the work that we as a group have been doing over the last 10, 15 years with Medical Home, and starting to think about the ways that we're working with, particularly with families of children with special health care needs. Now, does your practice provide what you would describe and think about as an accessible, welcoming physical space for children and families? Do you involve families in the development and modification of your systems, your policies, your procedures in the practice? Do you have some way that you're linking families in your practice together who may have children with similar diagnoses, who may have children who have had prolonged hospital stays, things like that? Do you have any way that you are currently asking families to evaluate their experience in your practice? And if you are a practice that has trainees, medical students, or residents coming out, do you involve families at all in the education of the trainees? So for just a couple of these, hands for practices who have families involved in development of policies and procedures, as an example. Got a couple hands. What about regular evaluations of the experience in your practice? So a few more. Okay, so we're going to focus more on the second page and some ideas about ways that you could begin to do that, because it looks like for most of the group, that's not a place that you've gone yet. So, as I said, the first place that I think we really started to think about partnering with parents was as part of working with traditional medical home, particularly for children with special health care needs. And so we've spent a lot of time talking about how we can make sure that families and patients feel like they are a key part of the healthcare team for their child, and that their opinion is just as important and valued as anybody else participating in the healthcare team. Clearly, we need to be thinking about a specific family's unique goals, values, priorities for their child when we're thinking about developing a care plan and the decisions that we're making related to care. Medical Home talks about making sure that families can get what they need from us, so things like access to clinical notes, timely test results, and other clinical information. And actually, I think the EHX is going to be an interesting step forward for us in this regional community. And then clearly we've talked a lot about strategies for developing chronic care plans, and again, that process is a clear partnership with families as you're doing that. So again, my guess is that most of us are working in this area, may feel like we're doing a pretty good job, a very good job. So what I want to do is start us thinking about the next step, how you could take a step forward. So let's think first about some pretty informal roles. These are not necessarily things that you're going to need to establish a long-term relationship with a particular parent or family, but that you could do periodically and may be helpful. So first thing is, take an actual or a virtual walk through your practice with a family. And it may be helpful to have a family of an infant, a newborn. It may be helpful to walk through with an adolescent. And then it's probably particularly helpful to walk through with families of children with special needs of various types. So children with developmental disabilities, medically complex children, and see what it's like to come through your practice for those families. Again, what is the physical space like? What is the waiting room like? What is your flow like? What works really well and what actually is pretty frustrating for families? Because we may not be asking those questions. And when we have, in our local center, we've heard some pretty interesting things. Also your virtual space. So how many practices in the room have a website? So it looks like roughly half. How many practices are using some kind of integrated or interactive patient portal? So a few, and ECW is kind of working with us on getting that implemented. So I think, again, taking a virtual walk through, what is it like to use your website? What is it like to use your portal? What would families like to see on your website or your portal that would be more helpful to them? So that's one thing that, again, is not a long-term commitment either on the family's part or on your part. The second thing is thinking about the educational materials that you have, and again, inviting parents to participate in developing them and tailoring them to the community that's in your practice. First of all, soliciting ideas before you start if you're going to be developing some new materials. We all tend to kind of jump in, launch in, we've got a great idea, we're going to kind of run with it, but we didn't actually stop to talk to anybody else and think about what might be the best use of our time or our resources. So you can think about soliciting ideas from families and then working with parents as you develop the materials to get feedback about them and make sure you're on point in terms of literacy, in terms of language availability, and then areas of interest. Okay. Then you can start to think about some more formal roles for families in your practice. And this, these do tend to be more ongoing relationships. And as we started thinking about this at Children's, it's a little bit tough because some of these can involve a pretty significant time commitment on the part of families. And particularly if you are looking for families of children with special needs, they have a lot, as all families do, they have a lot of demands on their time, a lot of responsibilities. And so one of the things that does come up is the issue of compensation for their time. Now, I'm not suggesting that your practices are going to have the resources to be paying parents at this stage of the game to be doing some of these roles. So I would think about developing a role that can be on a volunteer basis, but you're sort of keeping in mind how much time a parent realistically is going to have to devote to this and how much time you're going to have to be building that relationship, supporting that parent, and making it work. So here's a couple ideas. One, identifying families who are willing to provide peer-to-peer support or mentorship for other families in your practice, and we'll talk a little bit more about that. Involving families in creating and maintaining some type of resource, file, database, online resource. For us, that's always a challenge. We've got our drawer. Does everybody have your drawer of resources in your practice, right? And you make your drawer and you make it pretty and you put the colors on and you get everything lined up. And within 6 months, some of the stuff is no longer valid, right? And it takes a tremendous amount of work to keep that drawer up to date. So that's actually a great role for families. And these are families who are using many of these resources that you are referring people to. So if you had somebody who was interested in getting engaged with helping you keep that current, that would be a great opportunity. And then finally, we'll talk a little bit about growing interest in patient and family advisory councils composed of families who receive care in your practice. So let's first talk a little bit about this concept of peer-to-peer support. As I'm sure you've seen maybe happening in your waiting room, for me, I've had great experiences where different families of patients that I see have met each other like through infant and toddler, or in our physical, at the Hospital for Sick Children in the physical therapy department, and they have made these connections on their own, and it was a truly wonderful experience for them. You could actually be helping to facilitate that within your practice if you could identify some families who were at a point in their life as a parent of a child with special needs that they're ready to share some of their experience, be emotionally supportive, etc., with other families who are, again, moving through that process. So, again, first of all, that role of emotional support. The next thing is, as you know, working with us as healthcare providers can really be a challenge. And so we have found, and I'll tell you a little bit more about this in a minute, that parents can be great coaches for other parents about how to have successful visits with us and with specialists, and how to really feel like they're having effective communication with providers. So I think families can share with each other some really concrete strategies. Have your list of questions when you get there. This is the best way to get refills and things that you need through the practice, etc. And it's actually really helpful for us as providers too, because the visit just goes so much more smoothly. You can be more efficient if families come and the communication that needs to happen happens up front, so everybody can leave the visit feeling like they've gotten what they needed. The third thing is, as you know, having a child with special health care needs can have a tremendous impact on marriages and on the siblings of children in those families. And I think it's something that I know I don't spend a lot of time on in this comprehensive well child or care coordination visit. It's like way at the bottom of the list of things that I want to talk about. But it's something that's clearly in the mind of many families. So having somebody who has had at least their experience and is willing to bring up that topic and at least see how things are going in the family unit can be very helpful. We've talked a lot about helping to identify community resources. And then as children get into that 3, 4, 5-year-old age group and are entering Head Start or entering the school system, parents can be great resources for each other about things like, what is an IFSP? What is an IEP? What do you do at your IEP meeting? Again, stuff that you may not have time to sit and talk about, but that families, if they come in equipped already as an advocate for their child, can have a much more successful experience with school. Your other option is you may not have a lot of families who feel like they have the time to be that person in your practice, but there are a fair number of community organizations that also offer that service. So, you know, for example, here in Maryland, the ARC of PG County and the ARC of Montgomery County both have a list of organizations that do this kind of peer-to-peer support. So if you even had a point person who could then help families network with these other organizations that are providing that service, it doesn't have to happen right there in your practice. The other thing in this arena that I don't know if you all are getting into is thinking about using social media or other online resources. So there are a few people starting to experiment, for example, with online, like a Yahoo group or something, that parents in your practice who have kids with special needs could get on and do some sharing themselves. There are also some county-based interactive sessions like that. It does require having a moderator, so you would really need to have someone in your practice, could be a parent, could be a staff member who is interested in that and would be able to monitor the discussion that's going on within those online groups, because you don't want people sharing information that you as a practice don't think is something that you would recommend. But there are some people exploring that and using your website, using Facebook, things like that. All right, and second, parent and family advisory councils. So as I said, those are composed of families who receive care in your practice. That's a much more structured way to be getting ongoing feedback from families. And they can help you think through issues related to your office, including, again, your waiting room, your clinic flow, patient safety issues, and quality improvement activities that you may be working on either as part of your maintenance of certification or just out of general interest. Having parents participate in those quality improvement activities can be extremely valuable. And then, it just in general, these councils can be very helpful in having parents gain confidence and strength in their own voice in participating in your practice setting. There is just starting to be a little bit of literature about this, and I'm talking about a little bit of literature, but this is drawn from a study that was actually published in 2001 out of Massachusetts, in which there were parent advisory groups established in 4 community-based pediatric practices, and the families in those groups represented had children with a wide range of diagnoses. their sort of formative concept was that families have a lot to offer and teach each other independent of their children's particular condition and health status. And these groups were established as part of something called the GAPS program, which was operating in Massachusetts. And so there was sort of state support for this concept through the Department of Health. As part of this program, both the parents participating in these groups and providers were asked to fill out an evaluation where they had a list of possible benefits that they might expect to see through this participation. And I should say that these parent groups had parents, had healthcare providers, and then had a representative from the Department of Health. And the things that showed up from a parent's perspective as benefits for participating in this type of counsel were becoming more involved in my child's health care, learning about community resources, influencing the care that happens at my physician's office, making contact and networking with other similar families, understanding other families' concerns, increased use of public health resources, and feeling less isolated. The providers were also very positive at the end of this. Talked about having increased collaboration with children with chronic conditions and their families, also themselves learning more about community resources, and then general stuff about just feeling more aware of the needs of families, feeling more effective in caring for children with special health care needs, revising how their office staff cares for children, influencing how families care for children with special needs, and then individually changing the way that they themselves care for children with special health care needs. And finally, thinking about your own practice evaluation. So this is sort of what we talked about in the beginning about, do you have ways that families are concretely giving you feedback? So not operating just by sort of a patient complaint model where things that patients have brought to your attention bubble to the surface, but having a more systematic way for getting ongoing feedback. So here are some ideas that may or may not work into your practice. The first is doing just kind of a sampling in which you have somebody from your practice identified to contact families selected at random. You don't have to do everybody, but just sort of doing a selected group, following their visit just to discuss their recent experience. And you could have a list of 4 or 5 questions. They may focus on areas that you're trying to improve. So you may have already identified some things that you want to work on. You could focus just on those questions. If you're not sure, you could have some more general open-ended questions and get back that sort of over-the-phone feedback. Some practices are experimenting with what they call coffee hours or tea hours or lunch with Dr. So-and-so or things like that where families are invited into your practice for a non-medical visit to just sit down and have a facilitated conversation about something that's of interest to you working on your practice. We are working on this third strategy, which is actually having an identified family satisfaction survey, and that's in the context of the hospital being very interested in that. But so we are actually distributing a satisfaction survey tailored to primary care to all of our families when they come in for visits. And as you can imagine, we get a small percentage of those back, but in over just a few months, we had over 2,000 surveys, and that's very robust data, as you can imagine. And so we had perceptions about what we did well and what we should work on, but this is like pretty concrete data. And for me, leading a health center allowed me to say, listen, I need resources to focus on these 2 issues, which are unanimously what folks are concerned about the way that we provide care. And so it's a much more tangible and real way to then, again, reallocate or look for more resources. And then finally, utilizing focus groups of patients or families. If you have a specific issue arise and you're not quite sure what you should be doing to fix it, get a group of parents together and brainstorm, think it through. All right, I'll just share very briefly about the work that we have been trying to do in this arena, and it's through something that we call the Parent Navigator program. So they exhibited yesterday during the reception, so some of you may have had a chance to meet some of our navigators. I see Christine Dealeywood here. She's one of our navigators. You want to wave, Christine? She's back here. in the corner. We started in 2008, and like you, we were struggling to have resources to support this program as well, and we're fortunate enough to get some initial support through the DC Department of Health, and they have continued to support us, and now we also get some additional support from the Maryland Department of Health and Mental Hygiene. We now have 4 navigators. Each of them themselves is a parent of a child with special health care needs, and they just happen to have fairly diverse backgrounds and experiences in terms of their children, ages, diagnoses, and that kind of thing. And this service currently is provided to children in the Goldberg Center, so primary care at Children's National, and to children who come to our complex care program that many of you may have come to know, that provides care coordination for medically complex kids. Is anybody here in a private practice that is sharing care through the complex care program now? We have Dr. Karen Fratantoni, who's actually going to speak next, leads that program. So if you have any questions about it, she'll be here. I just wanted to show you the list of the types of things that families come to our navigators for. So again, we were able to have paid parents who are in our healthcare setting, and families can self-refer, providers can identify there's a family that's struggling with this issue, I'm not quite sure how to handle it, or I need some help thinking it through, and just look at sort of the range of things. Scheduling of medical appointments actually is the most common issue that families have, but followed closely by emotional support, and that's that peer-to-peer support that I was talking about before. And then you can see it runs the gamut: educational services, housing, durable medical equipment, transportation. Our navigators don't solve all of those issues, but they are very familiar with a lot of the resources and can help start to move people in the right direction, and then loop back and make sure that as the family went to try to work on that issue, that they were able to get what they needed. So in closing, I think my themes here is that we all can partner with parents around clinical care of their child. And I think that as everybody was nodding in the beginning, I think that we all are working on doing that the best that we can. The next steps then would be potentially identifying parents who are willing to provide peer-to-peer support and assistance around emotional support, community resources, whatever you feel like you and the parent is interested in tackling. And then looking in your practice for opportunities to involve parents in your planning and decision making, whether it's quality improvement activities, changes in policies and procedures, anything that's designed to improve care provided within your practice.